Okay, let's have a look at this week's figures for Greater Manchester, starting as always with the cases per 100,000 population. And these have shown some concern because we have seen, although there's been an overall decline, that we've had one or two districts bouncing up and down. The rate of decline is relatively slow, and we are almost without exception above the national average. I think the question we've asked ourselves is the extent to which this is worrying transmission rates, or is it increased detection? And increased detection, particularly within the context of the return to schools and education, where we have far greater numbers of people being tested, particularly through lateral flow tests. I've had a presentation analysis earlier in the week from Public Health England, which says that not only is this principally increased detection as a result of those tests, it is also increased rates of detection that fit within the expected range predicted by SAGE as we went back into the return to education. So whilst it's something we need to look very, very carefully at and continue to scrutinise, at the moment what is happening is within the bounds of what will be normal for the stage we're at within the COVID crisis and the stage we're at for slowly, hopefully, returning to normal. And we'll see this a little bit more in the next slide. This shows the age case rates, and you will see that in some places, so Oldham, for example, it's predominantly working age, and it looks pretty stable over a very long period of time. But if you look at a couple of the others, if you look at Rochdale, if you look at Bury, if you look at Manchester, if you look at Tameside, what you see there is an increase in positive tests in the 0 to 15 age range, and to a certain extent in the 16 to 29s, although that is predominantly the 12, comes from the 12 to 16 or 12 to 18 age range. And that reflects again, return to school, return to college, far higher numbers of tests taking place, relatively low positivity rates, but it still impacts on the prevalence figures. It's also said that these are almost without exception asymptomatic cases as well, so people that are showing no symptoms whatsoever, and repeat that this is within the range of what SAGE advised we should expect through that return to full-time education. If we can move to the next one. This is just looking at care home residents. This is telling quite a positive story. The now quite rapid decline in the number of care home residents with confirmed or COVID-19 or showing symptoms. This I think reflects the very high levels of residents who have now received their vaccination, and on that basis we would expect that to continue to go down. We still do have some concerns about the proportion of care home staff that have not been vaccinated yet, but we are working with all means possible to increase that number, and it is increasing quite significantly now. I think through a range of mechanisms, the ability to talk to people, that number is going up, and as a consequence of that, I would expect the numbers we're seeing here to continue to go down. Next slide. This shows what's happening in our hospitals. You will see now that there is some upturn in weekly admissions to hospitals for COVID-19, a very minor increase in inpatient diagnoses as well. I think you have to compare these to the peak when we were having 1,000 people a week, not 55 people a week. And it's the case that as the numbers get smaller, whilst COVID is still around, we are more likely to see ups and downs between one week and the next week. I think probably rather more reassuring are the bottom two sets of figures, where we see the number of intensive care beds occupied with COVID-19 patients continues to go down at a very steady rate. And notwithstanding that increase in admissions, the total number of beds occupied has gone down as well. So really, I think it is overall a positive story about what's going on in our hospitals. It is the case that the COVID crisis is over, at least for the time being. Clearly, there has got to be a lot of recovery, not least recovery of a lot of very exhausted staff, both in the hospital sector, but also the care sector, who've been doing wonders around discharge. Recovery plans, the return to normal, catch up, those plans are now being formulated. But I think we've reported previously that for a whole range of specialist operations, there are now massive backlogs for non-urgent operations, that people waiting over 12 months has increased significantly, and we just have to have a fair amount of patience. It is going to take time to bring those waiting lists down. By time, it's going to be weeks and months rather than days and weeks. And for people concerned, that they will be contacted by their GP or by hospitals to tell them when they can expect to be able to receive their treatment. Can we go to the next one? And this is the last one. For the very observant amongst you, you will notice that the percentage at the bottom has gone down rather than up, and that's a fairly peculiar thing to do, but the statistical basis for this has changed, and the denominator has now increased in size, particularly in the 18 to 49 age group, and it's that increase in the denominator that has caused the percentage to go down. I think it's something like 53% last week, now down to 50%. Perhaps rather more important, that the total number of people receiving their first dose continues to go up, and we're now beginning to make significant progress with second doses. You will all know that for under 50s, apart from people with the necessary medical conditions, there's been a pause of vaccination in April, and with a priority given to second doses, just to reassure again anybody who's expecting their second dose that we are very confident that we will have sufficient supply to be able to make sure that everybody who needs one does get their second dose. I think the progress with the over 50s and over 70s is probably the most important element of this, because those are the people who are most likely to be hospitalised if they do contract COVID, and we see very high levels of performance there. One of the concerns has been the spread of take-up, that we've had lower take-up in the more economically deprived parts of the conurbation, and there are some ethnic minority groups where the take-up has been significantly lower than the average. There is an enormous amount of innovative and work going on to address that. Pop-up vaccination sites, lots of door-to-door contact. We've now got the agreement to be able to do whole household vaccination using significant voices, trusted voices within communities in order to allay fears about the vaccine, and that's beginning to make a real difference. There was a presentation this morning at the beginning of Manchester City Council from the vaccination programme in the City of Manchester. It goes into some detail about what we are doing to address inequality in vaccination, and that will be to a greater or lesser extent reflected in the rest of the conurbation as well. So if you want a really detailed analysis of the sort of work that's taking place, that presentation is available online, and people who like a lot of detail and like a lot of numbers, it's really worth having a look at as a reflection of, say, very innovative work taking place to make sure that we do maximise vaccination in all of our communities. And I think for this week, that's it. Thank you.